Hello everyone, I am Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I am going to talk about the uterine causes of infertility. Uterus means womb. That is the organ where the pregnancy implants, the baby grows for 9 months and then the delivery happens. So uterus is the organ which supports the pregnancy throughout 9 months. So it's very important to evaluate the reasons related to the uterus if it is causing any problem in conceiving. So how do we evaluate the uterus? The uterus is actually a muscular organ and it has different layers. The innermost layer is called endometrium, the outer layer is called myometrium. So endometrium is the layer which actually develops as your egg grows in every cycle, and if the pregnancy happens, this layer endometrium supports the pregnancy. It allows the implantation of the pregnancy. And if the pregnancy does not happen, this is the same layer which comes out in the form of bleeding. So this endometrial layer undergoes hormonal changes and it grows under the influence of hormone. Once the hormones are withdrawn, this layer sheds off. So every cycle there is a new layer of this endometrium which develops. So this is about endometrium. Now coming to the myometrium, which is a muscle layer. So this muscle layer of the uterus, when the pregnancy happens, it undergoes hypertrophy and hyperplasia. Means the number of muscle cells will increase, the size of each muscle cell will also increase, so that the uterus can stretch over a period of 9 months and allow the pregnancy to grow naturally. So this layer of the myometrium has muscle cells which we call myometrial cells. So we will see what are the problems related to the uterus, what are the problems related to the endometrium, and what are the problems related to the myometrium. So uterus, if we see, there might be some issues, we call it congenital or present since birth, or there might be some issues which are acquired, means may happen after the birth as the lady grows because of either some infections or some tumors which may grow in the uterus. So these are called acquired problems. So we'll first see congenital or by birth problems. So what are the by birth problems? There might be problems with the shape and size of the uterus, which actually forms when the baby is growing in her mother's womb. So all the organs grow, when the baby develops, even the uterus develops around 4th, 5th month when the baby is inside her mother's womb. So a lady, when she's inside her mother's womb, the uterus starts developing. So how it develops? There are two paramesonephric duct which come and combine together to form a single uterus, and the part of the tubes which is in the center will slowly resorb to form a triangular cavity. So if we see on 3D ultrasound, we see uterus as a triangular kind of a cavity. So what happens when this development is happening? Sometimes there might be fusion related defects, like there is a problem in both the tubes fusing in the center. One of the tube may not develop completely, or they may not fuse properly, or both the tubes may not develop properly. After fusing, there might be problem which we call resorption defect, like the part which is supposed to disappear, so that the two tubes together will combine and will look like a triangle. So this resorption defects also result into the abnormal shape of the cavity, small size cavity. So what are these defects? So these defects are unicornuate uterus or bicornuate uterus, and there are different variations of these unicornuate and bicornuate uteruses. So the symptoms also will depend based on what variety of unicornuate or bicornuate uterus patient is having. So these symptoms can be related to the periods, like sometimes even not starting the menses, which we called like menarche. The patient may have primary amenorrhea, like will not have any periods, along with cyclical abdominal pain. So if there is no communication of the uterus to the vagina, there might be cyclical pain, means every time the lady is supposed to have her periods, there might not be any bleeding outside, but that bleeding may get collected inside her uterus or in the vagina and cause abdominal pain. So right from that symptom to maybe dysmenorrhea, which is period cramps or abnormal menstrual flow, all those symptoms can be related to that. So just one specific symptom, we cannot say that it is because of this. So how do we diagnose these conditions is by ultrasound, also by MRI, also by HSG. We come to know how is the uterus shape, how is the size of the cavity, is it unicornuate, is it bicornuate, is it septate uterus. So this is about the congenital problems of the uterus. So some congenital problems of the uterus may require correction, like septate uterus. Usually unicornuate and bicornuate uterus, we do not do any surgery, but some septate uteruses where there is history of recurrent miscarriages or prolonged infertility, then we may advise to undergo septal resection, that is removal of the septum of the uterus. So this is about congenital problems of the uterus. Now coming to the acquired problems of the uterus. So what are the acquired problems of the uterus? So these problems can be either in the endometrium layer or can be in the myometrial layer. So what are the problems with the endometrial layer? There might be, this layer might be very thin. So we say that between 8 millimeters to 12 millimeters thickness of the endometrial layer around time of ovulation is good thickness. So if we find that endometrial thickness around ovulation is less than 7 mm, 5 mm, 6 mm, 4 mm, then we call it thin endometrium. So this thin endometrium may not be able to support the pregnancy, may not be able to give that nutrition to the pregnancy. So this is thin endometrium. Second problem can be there might be adhesions in the layer of the endometrium. So these endometrial layers, which is like as we saw, the uterus is like a thick walled balloon. So what happens is, this is one layer anterior, that is the front part, and the posterior layer. So when there is nothing in the cavity, they are coming close to each other, they are abutting each other. So what happens is, because of some infections or some procedures like DNC procedure, what may happen is these layers will get damaged and they may stick to each other. So we call it adhesions. So what happens is, there is no enough space or this cavity which is available for implantation. So we call it intrauterine adhesions. So based on how much of the cavity is blocked by these adhesions, it might be either less bleeding in the periods or infertility or even the miscarriages, which may cause because of these adhesions. And there are various degrees of these adhesions. There might be mild adhesions, moderate adhesions, or severe adhesions. So this is the second problem, thin endometrium. Now adhesions of the uterus. Third problem could be endometrial polyp. So what are polyps? These are benign tumor-like growths of the inner layer of the uterus. So usually what happens is, if a polyp arises in one cycle, it might get shed off in the second cycle, so that it may not come again after the 2-3 cycles. But sometimes what may happen is, the polyp remains as it is and it may not go away when the lining sheds off. So these polyps, which are present in successive menstrual cycles, like back to back, if we are seeing the polyp for 2 to 3 cycles, and if the size of the polyp is more than 1 centimeter, and if it is in the upper cavity, then definitely it requires to be removed before becoming pregnant. So this is about the endometrial layer. So we saw thin endometrium, adhesions of the endometrium, then we are talking about polyp in the endometrium. So these are the pathologies of the endometrium, which may either result in infertility, miscarriages, or period related problems. Now coming to the myometrial layer. So what are the issues related to myometrium? So most common acquired lesion of the myometrium is fibroid. Almost 50 to 70% of the women sometime in their life they develop a fibroid. But not all fibroids will cause symptoms or they will cause infertility. The fibroids which are pressing inside the uterine cavity or distorting the uterine cavity, or we call it submucous fibroids, those fibroids can prevent implantation or cause miscarriages, and these fibroids definitely need to be removed before pregnancy. Fibroids which are not pressing onto the cavity, which are small in size, which are away from the cavity, may not need any treatment, and you will not have any problem in conceiving with fibroid. But large fibroids or multiple fibroids, even if they are not going inside the cavity, sometimes require removal for other reasons. So like having some urinary problems or related to passing motions, or some problems related to pressure on other organs, or the risk of any changes which may happen in pregnancy. So big fibroids or multiple fibroids sometimes require removal. So these are the issues related to the uterus which may affect your fertility. And how do we diagnose these problems is by means of ultrasound. It may not be possible to diagnose all the uterine problems with a single ultrasound sometimes, because as we already saw that uterus and the endometrium is undergoing changes with the hormones in every cycle. So may require some 2-3 ultrasounds at different times in cycles to diagnose the problem correctly. So get yourself a proper nice 3D ultrasound done from a specialist who is good in ultrasound, so that your uterus is completely evaluated and you know that it's not a problem for conceiving. So this is about the uterine problems which may result in infertility. So for any further queries, any doubts, if you have any issues related to your uterus, like any endometrial pathologies, any thin endometrium, adhesions, fibroids, then you can consult us at Ferty9 Fertility Center. I am Dr. Prachi, fertility specialist at Ferty9 Fertility Center, Banjara Hills.